Psychiatry, behavioral, and substance use disorders. This is the first block that we'll be solving, and these are UWorld and Miami questions. So this will serve as an instruction manual for you on how to observe to approach the question and how to approach the explanation and how you should be going on solving the Q bank. So I think this would serve as a good instruction manual and a good guide for you to understand on how to approach the questions. Right? You can find the information relating to this section under the behavioral science or the behavioral disorders section in the first aid or the psychiatry section, whatever it is called. But you can find all the information related to this there. So today we'll be solving 5 questions from the first block, and we'll see how it goes. So going on to the first question. So just understand on how I approach the question, and just try to understand on how I approach the explanation and the answer. Right. So I'll be telling you guys that that is the main focus here. And if you have any problem solving the psychiatry section in UWorld, you know which video to go to, right? This is the video to go to. Okay, so the question is the interruption of which of the following central nervous system pathways is most likely cause of the patient's presenting symptoms. 26-year-old woman presents to the clinic. So she's 26-year-old woman presents to the clinic due to absence of her last 3 menstrual periods. Bilateral milky discharge. She had menarche at age 13 and previously had regular menstrual cycles. So she had regular menstrual cycles. She reports taking acetaminophen for occasional headaches and a medication that stops the voices in her head. The BMI is 29. You must note the BMI in every question. Pelvic examination is unremarkable, and urine beta HCG testing is negative. So obviously, this either this is a reproductive problem or this is an endocrinological problem. The reason why I'm saying this is because the first thing that you need to understand is you need to narrow down your differentials. What is it that is coming into your mind when you're reading this question? There must be many students that don't have anything coming to their mind when they read this question. Is completely fine. uh, After this question you might have a lot of knowledge, but on average the first thing that I want you to think when you're sitting in the real deal is what are the first differentials that are coming into your mind? What problem is this woman really facing? First of all, they gave us a clue that she has amenorrhea, and this is secondary amenorrhea because she had regular menstrual cycles, right? And this is secondary amenorrhea. So this could be a reproductive problem, gynecological problem. But then we look at this sentence in the question which says that the pelvic examination is unremarkable and she's also not pregnant. So all of the reproductive things, all the reproductive differentials till now have been ruled out. Although we can go to the extent of saying that she is obese, so she might be uh, going through PCOS or polycystic ovarian syndrome. But the question does not give us any clues to go towards a reproductive problem. So all in all, this is an endocrinological problem. This is not a reproductive problem. So if we could just cross out that this is not a reproductive problem, but this is an endocrinological problem. Obviously, problem in the menstrual periods can only be reproductive or endocrinological. Uh, there cannot be any other etiology for this. So now, if this is an endocrinological problem, this is further strengthened by the fact that she is having a bilateral milky nipple discharge. So she's having galactorrhea, right? So amenorrhea with galactorrhea, with headaches, it pathognomically points towards prolactinemia. So this woman right now is having prolactinemia, right? She's also taking a medication that stops the voices in her head. So she's taking some kind of an antipsychotic medication. She's right now having prolactinemia and she's taking an antipsychotic medication. And the basic information that they are asking you in this question, which you should take away, the basic information is which pathway is disturbed in this situation. That is what they want you to know. Anything else in the explanation? So I'm just going to show you the explanation now. Uh, Not now, like first let's discuss about the answer, but I'm just going to show you an explanation, the explanation for this question in a bit. And I want you to see the explanation and understand that this is a very long explanation. There would be a lot of things that are important in the explanation, but what you need to take away is what they want you to know after solving this question. What they want you to know is which pathway is disturbed in the situation where a person is taking an antipsychotic medication and is going through hyperprolactinemia symptoms. So that is what we need to understand. Okay, so I'm just going to give you a few hints and then you select an answer, whichever you feel is correct, and then we will go to the right answer. So I've given you a hint that there's an antipsychotic medication and which is affecting something, and then there is hyperprolactinemia symptoms. What could be the answer? Right. So arcuate fasciculars could not be because it's not related to the antipsychotic medications. Hypothalamus spinal is not related to antipsychotic medications. Lateral medullary spinothalamic tract is not related to antipsychotic medications. Nigrostriatal pathway is not related to the antipsychotic medications. So D and F. So D and F are the two options that are available here. These two pathways are only pathways that are related to the antipsychotic medications. So I'll give you a second to think about this, and then we're going ahead. So the answer is tuberoinfundibular pathway. Now you can see that this is a very long explanation, as you can see. This is the pattern or the format in which UWORLD also explains the question. And all of this explanation is very important. Like this is all very important. But the problem is that you're not going to be able to remember all of this. So what you need to do is to go down and concentrate only on the educational objective. So dopamine, let's take out our highlighter. So dopamine released from the hypothalamus normally inhibits prolactin secretion through the tuberoinfundibular pathway. Antipsychotic medications block dopamine receptors in this pathway, leading to hyperprolactinemia, which can cause galactorrhea, amenorrhea, infertility, and decreased libido. So, what she's doing is she's taking antipsychotic medication, which, because obviously dopamine blocks prolactin, that is a relationship that you must know when reading this question. So, of course, there are multiple concepts that you must know, but even if you are reading for the first time, you don't know anything. What you need to understand is that antipsychotic medications, their mechanism of action is to block dopamine receptors, right? And another relationship that you must know is dopamine blocks prolactin. Normally, dopamine inhibits prolactin, so prolactin and dopamine have an inverse relationship. So, after knowing these two facts, they now you can just connect them and you can understand that if the patient is taking antipsychotic medications and dopamine receptors are getting blocked, so there's going to be hyperprolactinemia. Prolactin is not going to be inhibited, thus giving rise to symptoms such as galactorrhea, amenorrhea, infertility, and decreased libido that are given in the question. The question says galactorrhea and amenorrhea. And the third fact that they have actually asked you is which pathway is affected. So, tuberoinfundibular pathway is the pathway from which through which dopamine inhibits prolactin. So, you must know tuberoinfundibular pathway. This is the these are the three key facts that you're going to take away from this question. So there are three key facts that you're going to take away. One is that antipsychotic medications block dopamine receptors. The second is dopamine has an inverse relationship with prolactin. That's the second. And the third is that tuberoinfundibular pathway is the pathway in which this inverse relationship takes place. This is the pathway uh, that is interrupted when you take antipsychotic medications, and this is the pathway through which dopamine inhibits prolactin. So these are the three. key facts that you must take away from this question, you must remember. Now, they have a lot of, they've given a lot of explanation. I will wait for a few seconds for you to pause the video and read it if you want to. I'm not going to read the whole explanation, so you can go through it. You can go through these options if you want, but I'll go through just this one, the mesolimbic pathway one, because this is important, right? So the mesolimbic pathway projects from the ventral tegmental area to the nucleus accumbens and the limbic system. This is not important. This information is not important. So excess dopamine activity in this pathway contributes to the positive symptoms of schizophrenia. So antipsychotic medications also work by blocking the D2 receptors in this pathway. That is why I'm pointing towards this option only. It's because this was the only option that you must know about, and option that relates to the topic is that mesolimbic pathway is a pathway that is also blocked by antipsychotic agents. So along with the tuberoinfundibular pathway, mesolimbic pathway is also blocked. And this is the main pathway that leads to relief in schizophrenia patients. So this is the pathway that we actually want to block, but that the medicine is made to block this pathway. Antipsychotics mainly work on this pathway because this is the pathway that is leading towards the schizophrenia symptoms. But what we do is what the medications do is that they also block this pathway, leading to prolactinemia symptoms. So you must know that this is the one that we actually want to block, right? And this is the one that is actually what we want to target. And this is the one that leads to the positive symptoms of schizophrenia due to increased dopamine activity. So this concept you must understand. So this is a secondary concept. So if I could say that there is going to be 3 plus 1 concept. 3 are the main concept and 1 is the secondary concept that you must take away. But this is the most important. These 3 concepts are the most important that you must understand. Moving on. The patient's neurological abnormalities are most likely deficiency of the cofactor required for which of the following reactions? That's the asking reactions. So this is a kind of a biochemistry type question. The patient's neurological abnormalities are most likely due to deficiency of which, first of all, we need to understand which cofactor they're talking about. So 44-year-old man is in the emergency department. The police found him confused, agitated in a public area. During transport, he was started on IV fluids containing dextrose. Okay, you have to note the management. On arrival, he is disoriented but able to follow simple commands. Physical examination shows multiple bruises. Neurologic examination shows bilateral horizontal nystagmus, impaired lateral eye movements. Although emergency personnel report that his eye movements were normal when they initially assessed him, this is a very important point. Demonstrates unsteady wide gait with short steps. So he has ataxia. His medical records indicate several prior hospitalization due to alcohol intoxication. So basically, they're handing you the diagnosis. It's a very quite easy question. So we know that the person is an alcohol dependency patient, right? So we're talking about an alcohol problem in this question. They've actually given you the question with handed you the answer through this hint. So he is having a neurologic abnormality and he is an alcohol intoxicated person. He has alcohol addiction, right? So what neurological abnormality is related to alcohol addiction? So we could say that it is Wernicke encephalopathy or it's Korsakoff syndrome, right? Either Wernicke, either Korsakoff. Korsakoff syndrome is mainly highlighted by confabulations. The patient is creating lies to fill in the memory gaps. So Wernicke encephalopathy is what we are looking at over here. The mnemonic to remember Wernicke encephalopathy is a cow, right? So I don't know why this is happening. A, cow, COW. W is Wernicke, A is ataxia, C is confusion, O is ophthalmoplegia. Right? So I hope you remember this mnemonic. It's very important to know about Wernicke encephalopathy. So this patient is going through Wernicke's. Now there are two clues that get you towards the Wernicke point. One is that he's alcohol dependent, he's having neurological abnormality, he's not having confabulation, so you can reach the diagnosis of Wernicke. Or you can look at the symptoms. So he's having uh, eye problems, right? Ophthalmoplegia is what? It's eye movement problem. So he's having nystagmus, he's having lateral eye movement, so he's having ophthalmoplegia. Simple. It's not a name of any single disorder. Ophthalmoplegia is basically a name of eye movement disorder. Any disorder could be present. They can give you anything, and you would have to identify it as ophthalmoplegia. So there is ophthalmoplegia. There is unsteady gait, right? He's ataxic. Ataxia is also a general term. Ataxia means movement disorder. So he's having disordered movements. So he's having ophthalmoplegia, he's having ataxia, and he's also disoriented, which means he's confused. So this is Wernicke. Now they're asking Wernicke occurs due to deficiency of what? Now this is very easy. Okay. The most difficult part in this question is the biochemistry part, in which they're asking that first of all, let us determine what deficiency causes Wernicke. So Wernicke is caused by deficiency of B1, which is thiamine. Now the difficult part is that they're asking B1 is used in which of the following processes. That is what they're asking. This is a typical biochemistry question that you must know. Now you're not supposed to know the TCA cycle. You're not supposed to know any of the cycles. You're not supposed to remember the flowcharts, but the clinical importance of that cycle is very important. So B1 is used in certain cycles. You have to know what cycles they're used in because B1 is an important cofactor. Deficiency of B1 can cause a very important neurological disorder that we just seen. And it's a very common disorder because alcoholics are very common, right? So this is how you approach biochemistry. You learn the clinical importance of the theory. I'll give you a minute to go through this. Okay, and go towards the we will go towards the answer. So the answer is pyruvate to acetyl CoA. That is the answer. Okay. And I'm just waiting for you to read the question. So the explanation is right there. The explanation is right there, right? So Wernicke encephalopathy is a neurological disorder caused by thiamine deficiency, and something else which is very important, which I forgot to mention, is that alcoholic patients really, I mean, you don't need to know this, but I mean, if you know this, then this is good. That alcoholic patients, when they are found intoxicated, you are not supposed to start them directly on IV fluids containing dextrose. You're not supposed to do that. First, you're supposed to give them thiamine, and then you're supposed to start them on IV fluids and or glucose. So you're not supposed to directly give them glucose. You're first supposed to give them thiamine, and then you have to give them glucose. So that is the fact that you must know, right? Not important for this question, but generally important as far as biochemistry is considered. So they've also they've done this mistake with this patient that they've given them glucose containing IV fluids first, uh, rather than giving them thiamine. So that's what they're supposed to do. So essentially, pyruvate to acetyl CoA is the answer. And there is something they mentioned in this that thiamine acts as a cofactor for pyruvate dehydrogenase, which converts pyruvate to acetyl CoA, and alpha ketoglutarate dehydrogenase, which converts alpha ketoglutarate to succinyl CoA, transketose. The TCA cycle, transketolase in the pentose phosphate pathway, ribose 5-phosphate, and nucleotides. And then branch chain alpha keto acid dehydrogenase and alpha amino acid metabolism. This is the main enzyme. You just need to know what these enzymes are, where they are used. That's it. You don't need to really remember the reactions. That doesn't really come. Do you? If you do remember them, that's very good. So pyruvate dehydrogenase requires thiamine to convert pyruvate into acetyl-CoA. In thiamine deficiency, this reaction is impaired, leading to lactic acidosis and neurologic symptoms. So this can lead to lactic acidosis. You must remember that. So this is the reaction which requires thiamine. Okay, so there is this one option of alpha ketoglutarate to succinyl CoA. This reaction is catalyzed by alpha ketoglutarate dehydrogenase, which also requires thiamine. While affected in thiamine deficiency, the most critical and commonly tested reaction is related to Wernicke encephalopathy pyruvate. So this is something that you must know, that although this is also affected, which you must remember, uh, pyruvate to acetyl CoA is more tested, right? But because this is a UWORLD kind of a question, so they're trying to confuse you. But in the real test, they will not give you any sort of conflicting options. So don't worry about this. You're supposed to keep in mind both of them. Both of them are important, right? So I'll give you an option to. I'll give you uh, a chance to read the explanation, and then we'll move forward. These things are important, guys. You must remember the enzymes that are in these pathways. I'm not going to explain all of them because they're not important to the question. Right, so education objective is the first part. I did not skip to this, but this is the first part that you must read. First part, right? So thiamine deficiency can occur in chronic alcoholics and can lead to Wernicke encephalopathy, especially if you administer glucose-containing IV fluids first. You are just waiting for a disaster to happen. So thiamine is a cofactor for pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase, and transketolase. At least these three enzymes you must remember. Deficiency leads to the symptoms that we've already discussed, and early recognition and IV thiamine administration before glucose. So thiamine before glucose are essential to prevent irreversible neurological damage, which is Korsakoff syndrome. So Wernicke is reversible. So which facts do we remember? So I think we're just going to limit it to three facts as well for this question. Number one, IV thiamine before glucose in alcoholics. Okay, number one this. Number two is that uh, chronic alcoholics can precipitate Wernicke encephalopathy, which can lead to these symptoms that we've discussed: confusion, ataxia, ophthalmoplegia. So this is what you must remember. And second is that thiamine is used, which is the most third fact is the most important, is that thiamine is used in pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase, and transketolase, and also these enzymes that were mentioned. Branch chain alpha keto acid dehydrogenase. So these are three facts that you must know, right? Three important facts. You are to always skip to the education objective, read it first, and then go towards the option that is confusing you, and then go towards the rationale. Okay, this is done. Uh, the father notes, just before leaving, the father notes that his son plays with his sister's dolls and does not seem to have interest in cars or trucks like many other boys, and asks whether this is normal. 5-year-old boy is brought to the office, routine check, mother reports that he's doing well, able to read, knows his name, address, and enjoys singing, dancing, playing house. Older sister, the physician administers all age appropriate vaccinations in preparation for the family's upcoming trip overseas. So everything is normal. But the problem is that the father thinks that his son is playing with the dolls and not with the truck. So what is the so you need to basically understand that what this problem is and how to reassure it, or what to do, what to answer. So if you would know that whether this is normal or not, then only you will be able to answer. So he's 5 years old, right? And the fact that you must understand, take away from this question, is that it is normal in a 5-year-old child. Okay, but let's go towards the dialogues first. So this is there's no need to worry. Children don't fully develop gender identity until adolescence. It is helpful that you brought this up. Your son may have gender dysphoria and need additional support and assessment. I understand your concern. It may help him. It may help to have him play with male friends and spend more time with you. I understand concern, but at its age, it is best to allow him to play freely. I hear your concern. Let me reassure you that many boys play with dolls as a normal part of exploring the world. So there is also an ethical part on how to answer, and there's also a fact that you must know. So choose an answer, and then we'll go forward. So answer is I hear your concern. Let me reassure you that many boys play with dolls as a normal part of exploring the world. Right. So let's go towards the educational objective first. So in preschool age children, gender typical and gender atypical play preferences are a part of normal development. Children often explore a variety of toys and roles as part of social and imaginative growth. Pediatricians should reassure parents that interest in opposite gender type toys is generally normal, encourage free play, and avoid unnecessary labeling or interventions. Persistent cross gender identification over time rather than transient play preferences is what warrants for further evaluation of gender dysphoria. Persistent is the key word here, right? So as I said, it is normal for a preschool aged boy to explore. It's quite normal, but that's not the only fact that you must know. You must know how to answer the parent as well. So I'll allow you to read the explanation on this page first. Pause the video and read it. Okay, and then there was this option B, which allowed him to play free as well. So why is it not the answer? It's not the answer because the response does not directly reassure the patients that the behavior is normal, which is important to alleviate their anxiety. So first of all, you need to choose an answer that actually answers the parent, right? So you've just answered a part of their problem, but you're not reassured, and you just said that just allow your boy to play freely. You did not say that this is normal and allow your boy to play freely. So both of these aspects should be in the dialogue, right? You did not tell them that this is normal. Okay, so you did not tell them that this is normal. You did not answer their question. So both of these aspects should be answered in the question, in the dialogue that you're going to say to the parents. And then there was another option that might be a bit confusing. Is this is wrong because it's not related to playing with females or males, and the son has no evidence of gender dysphoria. And then there was this option, which is partially correct. While it is partially true that gender identity continues to develop, this statement is dismissive, right? So you're just saying that this is normal. You're telling them this is normal, but you're not acknowledging the concern of the parents, or you're not normalizing the behavior, right? So the point is that of course you need to reassure the parents what you're doing in this option, but you're not stating the fact. With the fact is to allow to play him freely, and this is normal, right? You're just saying that he doesn't have any gender identity. You're just saying that, so you're replacing one problem with another problem, right? And we don't know this fact, so this is just you don't need to give your opinion on something. You need to give your fact, right? So we don't know the fact. Children don't fully develop gender identity until adolescence is something that you don't know. It's still it's not a fact, right? So you can't just throw in random sentences in there. The reason why this option is better is because the in this option, in option A, you are reassuring the patients parents, and then you're also normalizing the behavior because it is normal. The reason is not that he doesn't have gender identity. The reason is that he wants to explore. So this is something that you must take away. So there are two facts I think you must take away. Is one, that is it is normal for preschool aged children to explore gender atypical preferences, maybe clothes, maybe dolls, whatever, right? And the second fact is that you must, in a question where you're choosing a dialogue, you must reassure the parent plus normalize the behavior. Both of them should be in the dialogue. And these are very easy questions to solve once you get an idea on how to solve them. Moving on. Okay, so she drinks a glass of wine several times a week but does not use tobacco or illicit drugs. Okay, uh, so this is a personality kind of a question. So, 29-year-old woman, she has depressed mood after breaking up with her boyfriend, and she reports being sad, difficulty getting out of bed, sleeping 16 hours, increased appetite, low energy, poor concentration, loss of interest, typical depression symptoms. She has two similar depressive episodes at ages 23 and 27. Okay. And describes brief past periods lasting several days in which she was unusually confident and optimistic. So, depressed and active. She was able to manage three part-time jobs simultaneously, felt well rested, energetic despite sleeping only for 3 to 4 hours per night. So I guess this is very easy question, but I'll let you guys solve it first, and I hope you solved it. So it's quite easy. Depression symptoms plus active symptoms will narrow down your differentials to just two of them, right? And that's the part where you have to choose between two of them. So now moving on. The option is answer is bipolar 2 disorder. Let's go towards the educational objective. So bipolar 2 disorder is characterized by recurrent major depressive disorders and hypomanic episodes, which are less severe than full manic episodes. Do not cause marked functional impairment or hospitalization. Recognition of hypomania is essential as misdiagnosis of unipolar depression can lead to inappropriate treatment with antidepressive monotherapy, which may trigger manic or hypomanic facts. So the number one fact, or not the most important, but something that you must know, is that you never give antidepressants to a patient that can show bipolar. So always rule out bipolar and then give antidepressants to the patient. Even if the patient is presenting as a depressed patient, you always give antidepressants first, and then, or you don't give antidepressants first. You first rule out bipolar always, and then give antidepressants. That is the first fact. Second fact is that if there is hypomania, then there is bipolar 2. Of course, these are two facts that you must know. So there are two facts that you must know in this question. Okay. Now, of course, you would have ruled it out to bipolar 2 and 1. Again, my pointer is somehow not with me today. It's not on my side today. So you just ruled out to both of these, right? Why isn't it bipolar 1? I'll give you a simple answer, right? You can read the explanation as well, but I'll just give you a simple answer. This is not mania because this is not severe enough, right? You can see in the question that she was able to manage a job and she was confident, optimistic. So she did not do anything that is too crazy, yeah, to say the least. If she would have done something that would have caused other people problem or problems to her or hospitalization, then that would have been mania. But if she was okay and there has been no problem, no hospital administrations, then this is hypomania. That is the simple and thick and thin of it. You can read the explanation here as well. and then we'll move forward. Okay. So, dysregulation of which of the following neurotransmitters is most likely to be the primary cause of this patient's new symptoms? All neurotransmitters are given. 32-year-old man has bipolar disorder, brought to the emergency department after being unable to sleep more than 3 hours per night for the past week. He has been irritable, arguing constantly, exhibiting racing thoughts, speaking rapidly, stopping work as a plumber to unravel secrets of the universe. So this questions, it is good that it has come after the last question because it is going to solidify the concepts of the last question. He has drawn shapes, equations on the wall, accused his wife of working for the police. He becomes agitated, hospitalized involuntarily. This is important. He has no medical conditions, everything is normal, prescribed multiple medications to address his symptoms. 5 days later, he is calm but displays severe psychomotor retardation. Does not move spontaneously, fails to respond appropriately to the questions, and appears newly disoriented and confused. His temperature is 102 Fahrenheit, which means he has fever. Blood pressure is 162 to 98. Dysregulation of which of the following neurotransmitters is most likely to be the primary cause of the patient's new symptoms? I would say this is a moderate difficulty question. Moderate difficulty question. And so I hope you guys selected the answer. Okay. So, 32-year-old man, history of bipolar disorder. And let's go to the educational objective. So, this is educational objective. Wait. This is the educational objective. Neuroleptic malignant syndrome is potentially life-threatening reaction to dopamine antagonist and presents with hyperthermia, severe rigidity, altered mental status, autonomic instability, prompt recognition and discontinuation of the offending agent are critical. So this is basically NMS, which results from acute dopamine deficiency, highlighting the role of dopamine. So the first fact that you must know is you need to identify this patient as NMS. So antipsychotics lead to NMS, right? So antipsychotics, again for some reason, antipsychotics lead to NMS. This is the first fact. So he was given antipsychotic medication. He has hyperthermia. He has high blood pressure. He is disoriented. Of course, they've not mentioned the rigidity, but they've mentioned other symptoms. So that's how they try to trick you. So of course, he's administered antipsychotics, and after a few days, also NMS occurs after a few days, where serotonin syndrome occurs after a few hours. That's what you must remember. So this is NMS, and they're basically asking which uh, neurotransmitter disturbed NMS. So this is the first fact for you. This is NMS. And dopamine is affected in NMS. So this is the second fact for you. So there are two facts which you must remember in this question. From this question, you're going to take out two facts, which is that this is NMS and NMS causes acute dopamine deficiency, or it results from acute dopamine deficiency. That is a better way to say it. NMS results from acute dopamine deficiency. And also you can look at the other symptoms. NMS is very, very, very high yield for you. This topic is very high yield. Okay. So you can read the explanation as well for other options. And you can read this as well. But the crux of the question I've explained. So you can read this as well. It's very important. The crux is that there are two facts. Number one, identify that this patient is suffering from NMS. Number two, NMS results from acute dopamine deficiency. That is it.